Alright, so let's get into some blood traces here that we're going to be using on the second exam. And this is from Mark Nielsen's anatomy course at the U. Alright, so we're going to start up in the thorax. And we learn a couple new blood vessels up here. But the main thing to understand how to do these blood traces is to know the muscles that we're going to be supplying. So it's important that we can make a chart kind of like this. And you'll want to be able to do a chart like this as well for yourself. But I'm going to do it here really quick. And we always use this pattern to kind of keep our muscles and their layers in order. Alright, so there's our vomus pattern. As Mark teaches, we got a ventral muscle, a lateral body wall, layered muscle, and then a subvertebral muscle. So we're just going to go through this really quick, and we're going to focus on the thorax as well as the abdomen. We want to know where these muscles are located so we know which specific blood vessels we're going to use in the trace. And if we ever have to use a collateral circuit, how we're going to do that as well. So in the thorax, we have the muscle called the rectus sternalis. You can also just call it the sternalis and omit the rectus there. In the abdomen, that muscle is called the rectus abdominis. So we know that is our ventral muscle. So we're going to have two major pathways to take blood to these muscles. There's going to be a posterior pathway or an anterior pathway. So we know that this muscle, these two muscles are our ventral or anterior group. So the pathway that's going to feed blood directly to these is the anterior pathway. So we'll talk about what that is as we get into the traces, but for now, those are going to be our anterior, supplied anteriorly with the arteries. Okay, so then in our outermost, in the thorax, we have these muscles called the serratus posterior superior, and we also have the serratus posterior inferior. I'll put some pictures of these muscles up on the slideshow so we can kind of visualize them. But these ones are strictly posterior muscles. They're right on the back. So what I'm going to do here is I'm just going to put a little P right here to let me know those are posterior. So they'll be supplied strictly by the posterior arterial system. As we get into the abdomen, we're going to have a muscle called the external oblique. This wraps around from posterior to anterior, and it's in the abdomen, which has a really simple blood supply. So for now, I'm just going to put that's a posterior supply. The external layer in the thorax, so our E, we're going to have a muscle called the external intercostal. This muscle runs from our vertebral column up until kind of where the costal cartilages are, so they don't reach all the way to the sternum and cover the whole rib cage. There's a tiny little window in the anterior most portion, but again, these can be supplied anteriorly or posterior. So this can be posterior or anterior. On the exam, Mark will specify if you're going to the anterior portion or the posterior, and that's gonna be the same for all of these other muscles we talk about. For our external layer in the abdomen, we have another external oblique. So since we have two external oblique layers, this one's going to be called the superficial layer. This one is called the deep. Okay. Again, that external oblique is going to be posterior, supplied posteriorly as well. Okay. Now we go to our middle layer of the thorax. We're going to call these the internal intercostals. Again, that's going to be supplied posterior and anterior because this wraps the whole rib cage, so we need to be able to supply the back part as well as the more front part. In the abdomen, we call this the internal oblique posterior supply. Okay, then we get to our internal layer of the thorax. In the thorax, we have 4 muscles that make up our internal layer. We have these muscles called the subcostals. I'm going to kind of box this off here. And then we also have this muscle called the transversus thoracis. We have a muscle called the diaphragm. And then we have another muscle called the innermost intercostals. So I'm just going to do this. Okay, so we have external intercostals, internal, and then innermost intercostals in the inner or internal muscle group layer. In the abdomen, we're going to have 2 muscles. We have a muscle called the quadratus lumborum, as well as the muscle called the transversus abdominis. All right, so there's our internal. There's our lateral body wall muscles. So 4 in the thorax for the internal, 2 in the abdomen for the internal, and there's the rest. And then we get to our subvertebral group. So in the thorax, we have a muscle called the longus colli. This is the one up close to that C spine, that cervical spine. It runs up the neck, kind of right below the skull. And in the abdomen, we're going to have these muscles, the psoas major, as well as the minor. So 2 little muscle, or the minor is a little muscle, the psoas major is a big muscle down in the abdomen. But there's our subvertebral group. So this is a chart that Mark could have you fill out on the exam. Just kind of tell me all the muscles I've taught you, basically. So to fill in a couple more things here, the subcostals. So let me draw a cross section of what the thorax kind of looks like. So, oops. Okay, there is the thorax. This is going to be posterior, anterior. So this is going to represent the bone in the anterior part, that sternum, and then back here I'm going to just kind of draw a vertebral body with the spinous process. So super diagrammatic. But the muscles that we're going to see here, we're going to have these subcostals. So I underlined that with blue. The subcostals are right back here, and they're that short. So they're very posterior. So they're going to be supplied by posterior arterial supply. So that's why I put a P there. That's why I put it in blue. So that's going to be a posterior supply. We have these other muscles called the transversus thoracis. These are actually on the inside of that sternum, so they kind of sit like this. So they're just opposite of the subcostals. Those are strictly going to be supplied by the anterior blood supply. And again, we'll get into what that is. We have these muscles called the innermost. So our innermost here. These innermost kind of span this whole lateral wall. So they wrap the whole inside. So if a muscle does that, it can be supplied by either the posterior or the anterior supply. It just depends on what part of the muscle you're trying to supply. And then we have the diaphragm. So I'm going to do the diaphragm in kind of this faded orange. The diaphragm is like the floor of the thorax. So I'm creating this floor. And the diaphragm is going to have 3 3 different blood supplies to it. So if I put a star here, we're looking at the top of the diaphragm, so the superior part. And remember, the diaphragm's kind of shaped like a dome here. And we're looking at it like this. So we're looking at the posterior and superior portion of it. So the top back part, that's what this star is. And that's going to be supplied by a posterior artery, which makes sense, it's really posterior. Then we're going to have this part of the diaphragm, which we would call the anterior superior part of it. So that's more anterior. This gets supplied by an anterior artery. And then we also have kind of just this most superior-most part. That is also going to be supplied by an anterior artery. So once we get into the traces, we'll talk more about that. And these subvertebral groups, subvertebral means they're right next to the vertebral column, so they're both going to be supplied with posterior arteries. Same with these ones up here. So now that we have our muscles all charted out and kind of know their location, now we can talk about the posterior versus anterior blood supply. So that's going to help us know where we're going to be going and how to get there. So here is what the posterior blood supply looks like. I'm going to scroll down here. All right, so coming off the heart, we have this big artery that is called the aorta. I'm going to represent the diaphragm in a dotted line here. So everything down here is considered the abdomen. Everything up here is going to be our thorax. So thoracic cavity up there, abdominal cavity below. The aorta is a very posterior artery. It runs right on the surfaces of the vertebral bodies, a little bit more on the left side of the body, but it's right back there. So our posterior, our main highway of the posterior musculature is going to be that aorta. And then coming off the aorta, we have these little arteries that run off like this. And they're segmental like this because they are actually sitting between the ribs. So if I put a rib here, we can call this brown a rib. Here's another rib. Here's another rib. Same thing on this side. These arteries that I just drew here, whoop, that's fat. So these arteries that I just drew here, we call these the posterior intercostal arteries. Intercostal means between ribs, so posterior intercostal artery. For a singular one, arteries for all of them. And that would be that's our posterior pathway. So if Mark told you to take blood to any of those muscles we just looked at, any of these posterior muscles on this chart, that would be your pathway. So here's an example. You're going to start in the aorta, and you're going to take blood to the subcostal muscle. And at this point, it doesn't matter which one, because the trace would be the same no matter if we're on the right or the left. So the trace would look like this. Aorta to the posterior intercostal artery, and then we would be at that subcostal muscle. So 2 blood vessels and you're there. You don't have to write arterioles and capillaries, venules anymore. That was more of a first exam thing. So the 2 arteries and then you're at that structure. So that's how we supply the blood to any muscle that's posterior. So we could interchange subcostal with the serratus posterior superior, the serratus posterior inferior, the external intercostals, the internal intercostals, the innermost intercostals, And I believe, oh, and then we have the longus coli as well. We can throw that in there because some of it is going to be supplied by this. So yeah, any of those muscles, and he would specify to you for these three here, he would say the posterior aspect, which just means it's going to be supplied by this posterior pathway. So there is our, I think we were blue for posterior. That is our posterior pathway. Aorta to posterior intercostal artery. That is our posterior pathway. So if you know that, you know how to take blood to any of those posterior muscles. All right, so now let's look at the anterior pathway. We just throw on a couple little extra blood vessels. It's not too big of a deal. I'm going to draw an aorta for us again. And instead of staying on the aorta, if we stay on the aorta, we're really posterior, which we can never reach those anterior-most muscles. So what we do is we use our aortic branches. So we have that first branch, there's the one going up to the head, and there's that one. And you should know what these are. If you don't, we have the brachiocephalic artery there, common carotid, and left subclavian here. You're not going to really worry about this carotid for this exam. The brachiocephalic splits into another common carotid and then that right subclavian. So that's as far as we need to worry about to supply these anterior muscles. So once we get to the subclavian, where if you think your clavicle is a pretty anterior bone, it connects to your sternum, and a lot of those muscles are right by your sternum. So that subclavian artery is going to act as the major highway for this anterior route. So off of the subclavians, I'll circle those here. There's our subclavian, and then we already have the subclavian here. But coming off of those, we have these arteries. So again, remember these arteries are really anterior. They actually run on either side of your sternum. So if you feel your chest bone and you just move to the side where you can't feel it anymore, that's where these arteries are. And we call these arteries the internal thoracic arteries. So we have one on either side of that sternum, one on the right, one on the left. So our internal thoracic arteries running down the sides of our sternum, they're going to send off these branches, and both of them do this. And then again, these are going to be running between our ribs. So if I draw a rib here, rib here, rib, 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 we would call these the We would call these the anterior intercostal arteries. So all of those little branches that come off the internal thoracic, they're anterior intercostal arteries. That is what is going to be our blood supply to the anterior parts of the muscles, or the ones that are supplied strictly anteriorly. So let's do a trace. We're going to take blood from the aorta, and we're going to go to the anterior aspect of the external intercostal muscle. All right, so the keywords here: anterior and external intercostal. So the keyword there, anterior, and what the muscle is we're going to. So I'm going to say aorta. Now I know if I stay on the aorta, that's my posterior pathway, and that does supply the external intercostal, but it does not supply the anterior part of it, and that's where we're going. So I need to use this pathway we just talked about up here. That looks like this. And let's go to the right side. So I'm going to say aorta, brachiocephalic artery, subclavian artery, and that's on the right side. Doesn't really matter if you specify that, because you use brachiocephalic, it kind of assumes where you are. Coming off the subclavian, we're going to have internal thoracic artery, and then coming off the internal thoracic, that's when we get the anterior intercostal artery, and then we would be at that external intercostal muscle. That would be the trace to any muscle that's anterior. So we can trade out external intercostal for internal intercostal, innermost, the transversus thoracis. So there's the muscles that can be supplied by that anterior route, those four muscles. So if you're taking blood to anterior aspects, this is our pathway. This is our anterior pathway. All right, so now that we've learned our anterior and posterior pathway, we're going to talk about this concept called collateral circulation. We haven't talked about the veins yet, and we'll get there, but we're just worried about taking blood to these muscles. So remember, our blue was our posterior supply, and our red was our anterior supply. So what a collateral circuit is, you use collateral circuits anytime one of those blood vessels that normally supply something gets blocked. So to simplify that, you have this artery that supplies a muscle and it gets pinched off. That artery no longer has blood in it, so the muscle still needs blood to function. So it needs to get that blood from a detour route. It's like if a road gets closed, you take a detour to get where you're going. So just to kind of make a simple diagram here, here's like a street intersection, and we're trying to get here. This is our girlfriend's house, and her mom's not home. So normally we would take our car like this. Let's say we live over here. We would drive like this to get to her house. Okay, let's say there's some construction going on, which blocks us off right here. So now when we try and leave our house, we hit that construction and they say, take a detour, you need to go a different way. So that's when we realize there's longer pathways that will still get us to the same spot. So what I'm going to do is I'm just going to draw a couple extra streets here. Oops. All right. So now, let's say we leave our house and we're going down this street. Now we're just going to take this turn here. Oops. We're going to take this turn here and then go around the blockage. But see, we still get on this road where the house is to get to where we needed to go. We just couldn't get there through the original way, which was this way. We had to take a detour, and in anatomy we call that a collateral circuit. So our collateral circuits look like this. We're going to move from the posterior intercostal to an anterior intercostal. And you should ask yourself, when would you do this? When would you go from the posterior intercostal to the anterior intercostal? Which pathway is blocked off for you? Is it the anterior pathway or is it the posterior pathway? Well, this would be an anterior path block. So somewhere that anterior intercostal got blocked off, but we were able to use the posterior intercostal to get blood into it. We took a detour. So if we flip that, then it would be a posterior pathway block. So let's kind of see what this looks like. We're going to start at the aorta, and I want to go to a subcostal muscle, which is a posterior muscle. So you should remember, if it's a posterior muscle, what is the blood supply? Well, it's a posterior intercostal artery. And again, I'm just shortening that. Posterior intercostal artery supplies it though. So we're going to from the aorta to a subcostal muscle, but the posterior intercostal artery that supplies it is occluded, or sometimes he'll use the word blocked, or pinched off. Basically, the blood cannot go from the aorta to that posterior intercostal artery. So if this is our aorta, this is our posterior intercostal artery, the blockage is going to be right there. So blood usually would flow from the aorta to go into that, but since there's that block there, it's just going to kind of go bam, 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 which means the artery, our posterior intercostal, has really low pressure. That artery can still be opened. There's just no pressure to like push it open. So we're going to push it open using our collateral circuit. So to do this trace, aorta to the subcostal, but that posterior intercostal artery is blocked, it looks like this. Aorta, subclavian artery, internal thoracic artery, which sends off an anterior intercostal artery. And remember, those anterior intercostals are really anterior. That anterior intercostal is not going to supply the subcostal. So what we have to do is, let's pretend this is our anterior intercostal artery, kind of reaching out with its blood. Here comes the blood in our trace. What's going to happen, since there's no pressure in this, we're just going to force the blood into that artery that's been pinched off. So we move from the anterior intercostal to the posterior intercostal artery, which is where we were trying to go. Remember my stupid analogy of trying to get to your girlfriend's house? Well, you always ended up on this same road, you just took a detour. We did the same thing here. The posterior intercostal artery was blocked, but that's what supplies the muscle. So see how we ended on what was blocked? That's how we get to the muscle. So that would be the end of the trace. So that's how you use a collateral circuit to get to a subcostal when there's a blockage. And the same thing can happen the opposite way. If we needed to go to an anterior muscle, but the anterior pathway was blocked, you would just go through the posterior pathway and force it through into the anterior pathway. So that's what a collateral circuit looks like. So now let's bring in the venous system. So we've talked about the arterial system. Actually, we're going to do one more thing. We're just going to talk about that diaphragm. And remember I said there was a posterior and then two anteriors. So I'll kind of draw a dome. Okay, there's our diaphragm. This is going to represent posterior back here. So if we want to go to this posterior part, just ask yourself, what was the posterior, the main highway of that? This is what the trace is going to look like if Mark tells you to go to the posterior aspect of the diaphragm. It's going to be aorta, to an artery that comes right off the aorta that's called superior phrenic. So that's going to come right off the aorta and hit that part of the diaphragm. So if we come back up here, and remember this dotted line is the diaphragm, we're going to have a little artery that comes right off called the superior phrenic artery. That would be your trace to go to the posterior aspect of that. What if Mark asked us to go to the anterior-most aspect? So the frontmost aspect, close to our belly. That would look like this. Aorta. And you have to remember, what is our anterior pathway? Oh yeah, we take those subclavians. So we're going to go subclavian artery. Coming off the subclavian, we have the internal thoracic artery. And then coming off kind of the terminal end at the end of our last rib in our thorax, so kind of you can feel where your ribs start curving. Following that curvature of the ribs, we have this artery that's called the musculophrenic, which is a branch off of that internal thoracic. So that musculophrenic is the one that feeds this most anterior part. The superior phrenic is the one that feeds this posterior part. And then finally, we're going to have one that feeds right here. And I'm just going to do that as a star. So I'll put this star over here. So that's the superior most, like the very top of the dome. So to get there, it's another anterior pathway. So we're going to take the aorta to that subclavian and then to the internal thoracic. And then that internal thoracic just sends off a branch. This isn't so much at the distal end as it is the more proximal end of that artery. There's an artery called the pericardiacophrenic artery. That is the artery that's going to supply that top part of the diaphragm there. And this actually runs, so you can't see that. This runs with the phrenic nerve and the pericardiacophrenic vein as well. So there's kind of this little bundle there that heads to that top part of the diaphragm. So that's the blood supply to the diaphragm. Those three arteries you need to know. You're either going to the posterior aspect, so this portion, or the anterior, or the top. Okay, so now we can talk about the venous drainage system. And similar to how we had a posterior and anterior arterial supply, we're going to have a posterior and anterior venous drainage system. And we're going to focus on the posterior drainage first. So the posterior drainage of the thorax uses what's called the azygous system. So if you think of the thorax, you have this big heart there, which separates your anterior from your posterior. And there's really only two veins that go into the heart, collecting blood from the body. You have the superior vena cava and inferior vena cava. The pulmonary veins are coming from the lungs, so that doesn't really count. But draining the body, you have the SVC, IVC. So we have to create this little extra system for the posterior, as well as the anterior, just because the heart is so large and has those two veins. So the posterior drainage, or that azygous system, kind of is shaped like this. And just remember, this is posterior. This is right next to that vertebral column. So if you open the body and you looked at their vertebral column from the inside, you would see this venous system kind of sitting right on the anterior aspect of the vertebral bodies. So it's shaped like this K. In real life, it's never like this. It's a lot more convoluted, but for the class, if you know the azygos looks like a K, that's perfect. We're going to label some of these vessels. So we have this guy here. We call this the azygos vein. Azygos means unpaired. So we can see it looks like a K, so it's not symmetrical. That's what azygos is referring to. We have this one over here, which is called the accessory hemiazygos. And then we have this one over here, which is just the hemiazygos. So just remember, accessory is up higher. A is the first letter in the alphabet, so it's the higher. Or you accessorize around your neck, so it's going up towards the neck. Whatever helps you remember that. So there's our three major vessels of that azygos system. Coming into each of these veins, we're going to have these little veins here. And these are veins that are sitting in the intercostal spaces. I'm going to draw a line right here because this line is representing the diaphragm. So we're in the thorax. That line down here is the abdomen. We're not worried about that yet. But each one of those little veins I drew coming off, these little guys here, as well as these ones here, those are posterior intercostal veins. They run right alongside with the posterior intercostal arteries, and they drain any musculature that's posterior. So we also have some coming into the azygos over here. So those are all posterior intercostal veins. So we have to remember there's 12 intercostal spaces, and each space is going to have its own vein, artery, and nerve. So far, if we count what we have here on this left side, we only have 10. So we have to have 2 more veins that are going to be draining. So what the left side has this little nub up here, which is not connected to the azygos vein at all. And then it has these 2 posterior intercostal veins draining into it. But this nub that we have up here, this is called the left superior intercostal vein. It has these 2 posterior intercostal veins going into it, and it creates a left superior intercostal vein. So looking at this left side, I'm going to redraw this. And this is something you probably want to be able to do on an exam. Just bust out really quick in case you need it to kind of visualize the stuff. So it's just a K and then a little fork like that. So this upper part, this is draining the first and second spaces. So in total, that's 2 spaces. And again, that's the left superior intercostal vein. So we have 2 posterior intercostal veins going into that. And then we had the accessory hemiazygos, which is going to have 4. So that's spaces 3, 4, 5, and 6. In total, that's 4 posterior intercostal veins. And then we get to the hemiazygos, and we have 6 posterior intercostal veins. So 6, 4, and 2 equals 12. So now we've covered each intercostal space there. So we're good on that side. And if we count these again, 7, 8, 9, 10, 11, and 12. These numbers are important because Mark can tell you to go to specific intercostal spaces. You need to know which space is going to drain into which vein. And that's why we're doing this. So then we come over to this side using the azygos. And there's 8 posterior intercostal veins that go into the azygos. So we need to drain 4 more. What this side does is there's this extra little extension here, and it has 4 posterior intercostal veins that go into it. So we had a left superior intercostal vein over here. This one that we just created, this little extra, that's the right superior intercostal. And that drains those upper 4 on that side, and it does go into the azygos vein. So the left superior intercostal vein does not, the right superior intercostal vein does. So the mnemonic they like to teach in lab for this, I'm going to draw it again. If you can draw this on the exam again, super helpful. Basically just do a K. Remember you have this little projection up here, and then you just do an extra fork. There's everything you need to know. And then you remember this dumb mnemonic. So 2, 4, 6, 8, for the blood to circulate. So the 2, 4, 6, 8, 4 represent posterior intercostal veins, and this gives you an image of kind of where things are going to be going and the levels that it's going to be draining. Okay, sorry, my computer went off. Okay, so what we need to know is this is headed to the left brachiocephalic vein. So that left superior intercostal goes into the left brachiocephalic vein. All of these other veins that are part of the K, they all go up right here through that azygos to the superior vena cava. That's their destination. So all the blood is going to go like this, and then eventually it wants to all end up in that superior vena cava. So that's the venous drainage of the thorax, the posterior part. So now if we look at a blood trace using this, we're going to do one here. We're going to do the aorta to the external intercostal, the posterior aspect, and then we're going to go back to the heart. So aorta, external intercostal muscle, and then we're going to go back to the heart. So let's do that. We're going to start in the aorta, obviously. The external intercostal posterior aspect is fed by the posterior intercostal artery, and then we're there. So we're at that external intercostal muscle. Okay, now that we supplied it with blood, we're going to drain it. So you just ask yourself, well, I supplied it with the posterior intercostal artery, I'm going to drain it with a posterior intercostal vein. And again, those are the veins that we just labeled all here, those little lines coming off. I didn't specify a side, so we're going to do the left 6th external intercostal. So we're in that left 6th intercostal space, supplying the muscle that's sitting there. So now I need to remember, well, I'm on the left side, and I'm in the 6th space. So I can just do this. 2, 4, 6. So I have 1, 2, 3, 4, 5, 6. That's where I am. That is going to go into that accessory hemiazygos. And that leads us into the azygos vein. And these are all veins. And the azygos vein drains into the superior vena cava, which goes into that right atrium. Cool. There's the trace. That's how we drain any muscle that's posterior And you can see why it's important if he specifies a specific intercostal space. In this case, it was the sixth one. You need to know, here's the top two, and then there's 3, 4, 5, and 6. It's not down here. There's just 6 posterior intercostal veins going into that hemiazygos, but this is actually where that 6th space is. So that's why I think it's helpful to be able to draw this K and kind of visualize where you're going with these traces. Okay, so that was posterior. Now let's do the anterior. Anterior is pretty much like the arterial system. Okay, so the anterior veins. The difference here, let's just do a visualization. So, or let's do a trace, I mean. So we're going to go from the aorta to transversus thoracis, and then we're going to go back to the heart. So key thing here is that transversus thoracis is an anterior muscle. So again, you should know that anterior pathway, aorta, and this doesn't matter if I'm going to the right or the left here. I'm just going to go to the left for this trace. So aorta, subclavian artery, internal thoracic artery, and then we're going to shoot off the anterior intercostal artery, and then we're going to be at that muscle. So anytime I do that, that just means we are at the location we're trying to get to. Mark will usually have a little box kind of similar to this saying there's the end of that part of the trace. So we took blood to it. Now we're going to drain that muscle. So the transversus thoracis, supplied by the anterior intercostal artery, is going to be drained by an anterior intercostal vein. The anterior intercostal vein drains into the internal thoracic vein, which drains into the brachiocephalic vein. And this has to be left or right because there's 2 brachiocephalic veins, whereas there's 1 brachiocephalic artery. And those brachiocephalics go into the superior vena cava. So the difference here between the arteries and veins is you can see the artery, internal thoracic artery, came off of the subclavian artery, where when we're looking at the venous system, that internal thoracic vein goes to the brachiocephalic vein, not the subclavian vein. So pretty much the exact same pathway with that minor little detail change. And that's where people will usually miss a half a point. Half a point's not that much, but if you miss 20 half points, then you lose 10 points total. That kind of adds up. So make sure you keep that in mind. But that's our anterior drainage. So as we hit the end of our veins and arteries, you can remember there's also collateral circuits with the veins. They would just work the same way as that artery. So the veins can get blockages, and they would just use the opposite pathway as the way the arteries came. So if we had a venous blockage problem in the anterior, the blood could just be forced to the posterior pathway to get back to the heart. So shouldn't be a big deal there. There's a couple extra arteries here. We have a couple organs we need to supply. So the 2 organs we care about a lot of things here, but the organs in the mediastinum that we care about is the esophagus, as well as the trachea, the principal, lobar, and segmental bronchi. And we're just going to call that our respiratory tubing. So the actual tubes, not the lung tissue itself really. Well, probably the lung tissue, but not picking up oxygen with that pulmonary circuit. This is taking care of respiratory tissue. So I'm just going to call it respiratory. So that could mean like the trachea, principal bronchus, lobar, segmental, etc., etc. So to supply these, you have to kind of think, where are they? The esophagus is right next to the aorta, which means it's posterior. So to supply the esophagus with blood, you're going to say aorta to an esophageal artery, and then you are at that esophagus. The esophagus runs down the entire length of the thorax. So if we're draining the right side of the esophagus, you're going to use the azygos via esophageal veins. So we're going to start with the esophageal vein. And then if we're on the right side, you're going to use the azygos. If you're on the left side, if you're up higher, you're going to use that accessory, hemiazygos. If you're lower, you're going to just use the hemiazygos. And that's just because the esophagus runs the whole length, so the veins are going to drain into different sections. If we're looking at the respiratory stuff, the trachea bifurcates before the diaphragm. So we're not going to use that hemiazygos here. So a trace like this is going to look like this. We're going to go to the aorta. Again, the trachea is pretty deep in there, up near that heart, near the aorta. So the arteries that are going to supply it come right off the aorta. This looks like aorta, and then you have these arteries called bronchial artery, and then you're there. So let's just say I went to the lobar bronchus. That could be any of the bronchi. To drain it, we have a bronchial vein. And then again, if we're on the right side, it's going to go into the azygos. If we're on the left side, we're only going to use the accessory, because the regular hemiazygos is too inferior and these veins don't drain into it. So that would be taking blood to the trachea and esophagus, or the rest of the bronchial tree. Alright, so we've covered the thorax. At the end of this, I'll just write a bunch of traces that you should be able to go through, and I'll do all the possible traces Mark could really throw at you unless he comes up with some new ones. But if you know the posterior and anterior pathways, you should be good. So now we're going to move down into the abdomen. So I'm going to draw our aorta. So there's our aorta. I'm going to put the diaphragm way up here. So now this is the abdomen that we're focused on. So the abdomen is going to have a couple branches that we're going to care about here. The first one it sends off up here is going to be right here. It starts with a C. And we call this the celiac trunk. And that's going to be kind of right here. So we have our celiac trunk. And I'm going to make a little key over here. So celiac trunk. The celiac trunk is going to supply blood to our foregut as well as the spleen. The foregut organs are the esophagus to the duodenum or duodenum. So esophagus, stomach, and duodenum. Those are the major organs we're going to be supplying here, as well as the pancreas and the liver. Those are kind of off-growths of the duodenum. So there's those that we are going to supply. The next vessel we have, I'm just going to illustrate like this, starts with an S. This is called our superior mesenteric artery. So superior mesenteric artery right there. The superior mesenteric artery, or the SMA for short, supplies the organs of our midgut. So now we're strictly talking gut tube. Unlike the celiac trunk, which fed the spleen, which is not a gut tube organ. The superior mesenteric artery supplies our midgut, which, if you can remember, is our jejunum to our transverse colon. So jejunum, ileum, cecum, ascending colon, and then that transverse colon. So all of those organs supplied by superior mesenteric artery. Next we have these paired arteries that come off the aorta here. These are starting with an R, and these are our renal. Those go to the kidneys. Probably won't use that for this exam because we used them in the first one, but just know they come right off that. They come off the aorta inferior to the superior mesenteric artery. Next we have these two little guys that start with the G. These are going to be called, in general, our gonadal. So the gonads are either the testes or the ovaries. So if you're going to a testy, you call these the testicular. If you're going to the ovaries, these are called the ovarian. So it depends on which structure you're going to. You're going to call them testicular or ovarian. The classification is just a gonadal artery. And then finally, we're going to have this final artery here that starts with an I. And this one here is called the, I'm going to make a line here. This is called the inferior mesenteric artery. Short is the IMA, inferior mesenteric artery. This supplies the organs of our hindgut, which is the descending colon, the sigmoid colon, and the rectum. So descending colon through the rectum. So if you remember that mnemonic, Ed and JT are doctors. That keeps your foregut, midgut, hindgut kind of in order. So the easy ones here, let's look at this really quick. So this has another mnemonic to keep them in order as they come off the abdominal aorta. Is can, Superman, really, go, invisible. And that's a stupid mnemonic, but it can help you keep things in order if you need to, especially on a practical in a lab setting. So let's do the easy traces. The easy traces for this course are using the superior mesenteric and the inferior mesenteric arteries. So we're just focusing on taking blood to them. So I'm going to generalize this, but you should be able to take blood to all of these organs. So let's say Mark tells you go to any midgut organ and then go back to the heart. We'll get to the veins soon, but I'm just showing you the blood pathway. This looks like this. Aorta to the superior mesenteric artery. And then you're at a midgut organ, which could be the jejunum, the ileum, the cecum, the appendix, the ascending colon, or the transverse colon. So if he tells you to go to any one of those organs, you're going to use the superior mesenteric artery. And we'll talk about the veins soon. Let's say Mark tells you to go to any hindgut organ. So the aorta to any hindgut organ. You need to know what the hindgut organs are. He won't just say go to the hindgut. So remember, the hindgut is supplied by the aorta going to the inferior mesenteric artery. And then you're at the hindgut organs, which is that descending colon, the sigmoid colon, or the rectum. So 3 of those organs are supplied by the inferior mesenteric artery. So those are the easy traces. You hope you get a lot of those. Now we're going to focus on the foregut, which again uses that celiac trunk. So we're going to look at the foregut. And this is another thing I kind of recommend knowing how to sketch really quick. Because if you can visualize these vessels, it makes it a lot more simple than kind of trying to do it in your head, I think at least. So what I'm going to do here, I'm going to draw a really big aorta. Okay, there is our aorta. Coming off the aorta, we're going to have a blood vessel that's like a little trunk. So anytime we have a trunk, usually trunks have branches on them, like brachiocephalic trunk has the 2 branches. In this case, we're going to have 3 branches. So to orient ourselves, we're looking at this body. This is going to be the left side. This is going to be the right side. This is superior. This is inferior over here. Okay, so we're just looking at the celiac trunk principal branches first. So coming off the trunk, going towards that left side, we have an organ over here called the spleen. I'm going to just draw a ball like this. That's our spleen. The artery that goes to that we call the splenic artery. So there's our splenic artery. We have an artery that goes off to the right side. We have a big organ on the right side of our abdomen. We call this the hepatic artery. It's headed towards the liver. So anytime you see HEP, that's kind of referring to the liver, hepatocytes, hepatitis, etc. And then we have an artery that kind of stays in this midline. So this is diagrammatic, but we call this the left gastric. Gastric in this case is referring to the stomach, and specifically this more left part of the stomach. So now I'm going to take this picture and just kind of shrink everything. There's our celiac trunk. Going to the left, we have the splenic artery. Going to the right, we have the hepatic artery, and kind of staying in this midline, that is what we call the left gastric. All right, there's our 3 branches off the celiac trunk, and then these are going to send off more branches. I'm going to draw in a structure here which will kind of give us some context. So this dotted line that's going to represent the stomach, and this one's a little bit distended, that's okay. And then we have that esophagus, which would be coming up, and then we have the fundus over here. There's our stomach. This is kind of where it's sitting. So we have that lesser curvature. So where the lesser curvature is where that left gastric is sitting, and it's specifically on the left part of that lesser curvature. Okay, so now we're going to look at that splenic artery. The splenic artery sends a branch going down like this to the greater curvature on the left side. This artery is called the left gastro for stomach omental, and it's an artery. So if you can remember, you have that big fatty structure hanging off the greater curvature called the omentum. This artery is going to supply that omentum, and it kind of runs in it along that greater curvature. But that's where that omentum is sitting. So we have a left gastro-omental artery. The splenic artery also sends off a branch going to the fundus of the stomach. This is what we call the short gastric. And that goes to that fundus. All right, so there's our splenic artery. Sends off the short gastric and the left gastromental, as well as supplying the spleen. Okay, covered the left side. Now we're going to look in the middle. So we have that left gastric. I can zoom in there. There's our left gastric right here. And again, that sits in the lesser curvature. If we have a left gastric, we're also going to have a right gastric, and that one actually comes off the hepatic kind of over here. And that's going to supply the right part of the lesser curvature. So the gastric arteries sit in that lesser curvature. And that comes off of the hepatic. So the hepatic is going to go kind of like this. There's the terms called proper hepatic and common hepatic. That doesn't really matter, but I'm going to draw our liver in here. Okay, so the hepatic is just going to head up to that liver. It sends off the branch to the right gastric. And then it also sends off another branch going down like this. And this is a little far, or a little extended, more so than in real life, but again, it's just a diagram. So the branch that comes off like this, we call this the gastroduodenal or gastroduodenal artery. It's going to supply a part of the stomach as well as the duodenum. It's right next to it. And the gastroduodenal is going to send off two branches. We have one that's going to go that way and one that goes over here to the greater curvature. That meets up with the left gastroomental. This one is called the right gastroomental. And whenever we see arteries meeting like this and like this, that's what is called a collateral circuit. And we only use collateral circuits if there's a blockage, never normal flow, but we do have those two collateral circuits around the stomach that we can use if we need to. Coming over to this final branch here, this is called the pancreatico duodenal artery. Supplies the pancreas and some of the duodenum, and it's a branch off of gastroduodenal. So there's the branches we need to know. There's one more tiny one coming off of the left gastric. I'm going to kind of zoom in here. Coming off the left gastric, going up to the esophagus. Remember we had esophageal arteries. Well, this is the one. The esophagus is a little bit in the abdomen, so we have esophageal artery headed towards that esophagus. That's down in the abdomen. So there's the arteries of the celiac trunk, and these are supplying the foregut organs. So again, something you want to know how to draw. This is how you would do it. You do a little straight line. You know, you have one going to the left, you have one going to the right, and you have this little curly guy in the middle. And I like to finish them with arrows, kind of. So we have this artery which goes up to the liver, and then we have one that kind of goes down like that. Okay, so I know I need to do an arrow up here as well as an arrow going down like this. And then I have one meeting over like this. Then I have one meeting over like this. There's the whole thing there. So if you can do a simple visualization drawing like this, it can kind of save you time. You can visualize things a lot easier, at least I think. You just have to make sure you remember what everything is named. So like there's the splenic artery, there's the left gastroomental, there's the right gastroomental, right gastric, left gastric, short gastric, celiac trunk, hepatic, gastroduodenal, pancreaticoduodenal. There's all the arteries there. So that is what we just went over here. And here's Mark's picture of kind of what I'm trying to simplify. Alright, so moving on from the celiac trunk arteries, now we have to know the venous drainage of the gut. So foregut, midgut, and hindgut are going to use this drainage. And it's another picture you can learn how to draw, save you some time in studying, help you visualize things. So if you can draw a B, and then there's a little extra hang off here. So just draw a B. That is what the veins look like here. So again, we're going to go through and label all this stuff here. I'm going to draw a line here. That's not a label. That's just a line kind of separating some things. So this, I can kind of just show where I'm trying to outline. This is what we call the hepatic portal vein. So there's our hepatic portal vein. The hepatic portal vein is a large vein that's going to collect all the nutrients from the gut tube and head it or send it into the liver, where the liver is going to filter out toxins, etc. But every nutrient that comes from the GI basically has to pass through that hepatic portal vein before it gets to the liver. I'm going to do some more separation here. Okay, so this is where our gastric veins are going to be. Alright, so here I have these two circles. This is what's going to be called the left gastric vein. So that's draining that lesser curvature. And then we have the right gastric vein. Both of those pathways are kind of gonna go like this. They're both headed towards that hepatic portal vein, which eventually is gonna head into the liver. And I'll show you what that looks like once we get there. And then we come down here. There's a couple separations. So right here we have the splenic vein. Its blood supply just wants to get into the hepatic portal vein. Right here we have the left gastromental vein. This one can really go either way, but usually it goes up to the splenic vein. And then over here we have the right gastromental. Okay, and then this one here is not connected to that right gastromental. It actually goes up to that splenic vein. This vein here is called the inferior mesenteric vein. So if you can remember, the inferior mesenteric artery supplied blood to the hindgut. The inferior mesenteric drains blood from the hindgut. And it goes up to the splenic vein before it goes into that hepatic portal vein. Then we have this one over here, so kind of this extension. That's going to be the superior mesenteric vein, which drains the midgut. So all of our gut tube organs are coming into the hepatic portal vein eventually. So there's those veins. The hepatic portal vein goes up into the liver. So here's our liver. And we have a bunch of little capillaries in the liver. So imagine those are capillaries. The capillaries of the liver, so these things, are called hepatic sinusoids. Those are just the named livers, kind of like how glomerulus in the kidney was the capillaries of the kidney. Hepatic sinusoids are the capillaries of the liver. So the hepatic portal vein turns into hepatic sinusoids, and then the liver is drained by a vein called the hepatic vein, which is going to drain into the inferior vena cava. So that's just kind of an overview of the venous drainage. So again, if you can draw something like that for the arteries, this is what you would draw for the veins, just like that. We call this is referred to B with a kickstand. This is something I made up just to kind of simplify. But again, here's Mark's two images of those. Okay, so now we want to be able to do blood traces. Here's a couple. You should be able to do these. All right, aorta to the spleen to the heart. So the spleen is fed by the celiac trunk via the splenic artery. So I'm going to do that. We're going to do the aorta. Whoops. So celiac trunk. And then we get that splenic artery going off to the left side. And then we're at the spleen. So to visualize that really quick, if we look at this picture, I'm going to use this red celiac trunk, splenic artery, and we're at the spleen. So that's why it kind of helps. Oh. Okay, so now to drain the spleen, we're using that B with a kickstand. Again, splenic artery supplied it, so splenic vein is going to drain it. The splenic vein drains into the hepatic portal vein. You can see that there. There's the splenic vein going into the hepatic portal vein right there. The hepatic portal vein goes into the liver, and now it's called the hepatic sinusoids. And then we're draining those sinusoids via the hepatic vein, which goes into the inferior vena cava, when then we'd be in the right atrium. Cool, so there's that trace. Aorta to the spleen to the heart. Let's say this was aorta to the left lesser curvature to the heart. That would look like this. Aorta, celiac trunk, left gastric artery. Then we're at that structure. That's what this is representing. To drain it, we're going to have the left gastric vein. And now you have to remember, what was that? So it was up here, and that's just going to go into the hepatic portal vein. Hepatic portal vein turns into the hepatic sinusoids. Then we have the hepatic vein. And then we have the inferior vena cava, right atrium. Okay, so pretty basic there. This is where he can throw a wrench into things. Let's say we want to go to the spleen, but that splenic artery is blocked proximal to the left gastro-omental vein, artery. Okay, we want to go to the spleen, but the splenic artery is blocked proximal to the left gastro-omental artery, and then we're going to go back to the heart. All right, so that's where this comes in handy. So there's my celiac trunk, there's my splenic artery, there's my left gastro-omental, there's hepatic going up to the liver, there's that, there's how it forks, there's that, there's that. There's the arteries I need to know. So I'm trying to get here. The splenic artery, which is right here, is blocked proximal to the left gastro-omental, so the blockage is right there. So somehow I need to get there so I can just visualize my pathway. It's going to look like that. So to write that out, aorta, celiac trunk. Now we're going to go to the hepatic artery. The hepatic artery sends off the gastroduodenal, which sends off the right gastro-omental. So we're down right here. That collateral circuits with the left gastro-omental, which goes up into the splenic artery, and we can go into that because the blockage is happening before. And remember, if there's a blockage, there's no pressure, so the blood's just going to push into the artery that's not receiving blood. So we're in that splenic artery, and then we would be at the spleen. So to drain it, we're going to do our splenic vein to the hepatic portal vein, to the hepatic sinusoids, to the hepatic vein, to the IVC, to the right atrium. So that would be that trace with the blockage. So again, be comfortable with these. If you were going to do one of these traces, let's see, where did they go? Oh, these ones. Okay, so this was going from the aorta to the midgut, and these were representing our midgut organs. So to drain this, you use the superior mesenteric vein. That superior mesenteric vein drains straight into the hepatic portal vein. So if we look at our B with the kickstand, we're looking at this area down here going up into the hepatic portal vein. So that's what we're looking at. The hepatic portal vein goes into the hepatic sinusoids, hepatic vein, inferior vena cava, right atrium. So that kind of gets repetitive there, but it's good to write that over and over so you can memorize it. Here's the trace for the hindgut. So there's our organs that we supplied. We're going to drain it with the inferior mesenteric vein. That inferior mesenteric vein, if we do the B, this is the inferior mesenteric vein. That goes into this vein called the splenic vein, which goes into the hepatic portal vein, and then we go through that liver pathway with the sinusoids, etc. So that's how we get blood to and from the gut tube. All right, so here's another little detail, something Mark likes to do on these traces. So if you can remember, we had the gonadal arteries, which were the testicular and ovarian. So what I'm going to do here, I'm just going to draw the abdominal aorta, and I'm going to draw those two arteries coming off. So there's our gonadal arteries. Let's call this a male. So these are our testicular arteries going down to the testes. Now what I'm going to do is I'm going to draw the inferior vena cava. There's our inferior vena cava, pretty similar to the aorta. In this case, however, on the right side, so this is the right, this is the left. On the right side, that testicular vein is going to come straight up into the inferior vena cava. On the left side, we have this, which is headed to the kidney. That testicular vein on the left side goes into the renal vein first, and then the inferior vena cava. So if Mark asks you to go to the testes, aorta to the testes, to the heart, and if he told you the left testis, it would be aorta, testicular artery, and then you're at the testes. And then to drain it, testicular vein, then it would be renal vein, and then IVC. So again, that's just a little half point there, but it's a thing he likes to do, a thing you don't want to be tricked by. And this would be the same for the ovaries as well. Same type of drainage. Alright, so last arteries we need to cover are the arteries that are going to supply blood to the muscles of the abdomen. So here's a little diagram of what that looks like. So we just got finished taking blood to the abdominal organs. Now we're taking it to the muscles. So again, we're going to have anterior and posterior pathways here, but it's a lot more basic. So I'm going to use this highlighter to kind of show what we're talking about. So we're going to the ventral muscle of the abdomen, called that rectus abdominis. Rectus abdominis is our ventral muscle, so it's anterior. Those internal thoracic arteries turn into, after you pass where the diaphragm is, kind of the last rib you can feel on the front, it turns into the superior epigastric artery. And that's going to supply the superior aspect of the rectus abdominis. So the superior part of that muscle is going to be supplied by that. So that trace would be the subclavian to the internal thoracic to the superior epigastric. And that would supply that, the rectus abdominis, the more superior part. If we're looking at the inferior, part, we have inferior epigastrics, and where this green circle is, there's a collateral circuit between inferior and superior epigastric. Those inferior epigastrics come off of the external iliac artery. So there's the internal iliac going into the pelvis. This one's not drawn totally correct here. So labeling this stuff, there's our common iliac. And then here, where those inferior epigastrics are coming off, that is the external iliac. And the veins drain into the same external iliac vein as well. So the veins are pretty much mirror images of these. So just remember, inferior epigastric comes off of external iliac, superior epigastric comes off of internal thoracic. And the veins are pretty much the same. When we look at the posterior drainage or supply, this is this tube here, that's the aorta. And the aorta just sends off these arteries called the lumbar arteries. There's no posterior or anterior. They're just called lumbar arteries. And that's going to supply all of those muscles of the abdomen we talked about, minus the rectus abdominis. And then when we look at the drainage, so that this brown line here, that's the diaphragm. So we're separating the thorax from the abdomen. Here's the inferior vena cava. We have lumbar veins here and here, here. Those are all lumbar veins. But then we have these ones here and here, which are going up. The blood is actually going up like this, or it can go up like this. Veins just want to get blood back to the heart. It doesn't matter which way it goes. They're not trying to give oxygen, so it's not super important. Those are called ascending lumbar veins. Those actually are going to come off the common iliac veins down there as the IVC bifurcates. Or the blood can go up and it turns into this K. So that ascending lumbar vein on the right side turns into the azygos. The ascending lumbar vein on the left side turns into that hemiazygos over here. I've never seen him do a trace like that, but just know that anatomy is continuous and it's all connected like that.